And good morning. I'm Tracy Sinclaire here at Alaska's News Source. And May is Stroke Awareness Month. And I have a personal history. My mother had a stroke many, many years ago and didn't recover terribly well. And later we kind of discovered that the early signs, when they maybe could have reacted a little faster, my dad just didn't recognize them. So we want to talk a little bit about some of those signs. I think my mic is cutting out just a little bit, but we'll make that. We want to talk about some of the signs and how you can prevent them. And so joining me today, we have two people who can speak very well on this topic. Dr. Robert Lotta is with us, and also Chelsea Hunt. Chelsea is a stroke survivor. So thank you both for joining us here. Dr. Lotta, let's just kind of start with the basics. What is a stroke? I didn't understand it when my mother had one. So what is a stroke? How do we define that?
So stroke is a term that we utilize to describe injury to the brain, typically due to a problem with blood vessels. And we divide those into two main categories, which is either a bleeding type of stroke, which we term as a hemorrhagic stroke, and then a non-bleeding stroke, which is called a ischemic stroke. The majority of the cases of stroke have to do with blood supply being interrupted and prevented from getting to that part of the brain. And that's about 80% of all the cases that come in. So you got the stroke is that overall category. And then underneath that, we have bleeding strokes and non-bleeding strokes. What happens with a stroke is just one part of the brain is now no longer functioning. So use the term focal, meaning just that one part isn't working. So that can manifest in a lot of different ways. It can come in with weakness on one side. It can be vision changes, slurred speech, a variety of things. The critical part of stroke is it happens suddenly. So there's no symptom that's there, and then suddenly something happens. Now, unlike heart attack, which was really easy to educate the public with, saying that, hey, there's a heart attack, there's chest pain, I have arm pain, jaw pain, get to the hospital, it was really easy to communicate. Stroke is a little harder because it's such a variety. So the first part to recognize, it's sudden. We utilize the term be fast. And so that's what we teach all our patients, anybody at risk for stroke, to understand the signs and symptoms of stroke. So be fast. So B is balance. E is eyes. F is face. A is arm weakness. And S is speech or comprehension. And T is time. So when a brain is losing blood supply, it is dying very quickly. So I think of it as a major forest fire that's moving very rapidly through the brain. And to think of it, about 1.9 million nerve cells are dying every minute when that stroke is starting. And so we want to recognize those signs and symptoms. So I tell patients that if there's a sudden change, first thing you do is, can you stand up? Can you see it around the room? Is there a facial droop? Is there arm weakness? Or are you having problems understanding or speaking? And getting to the hospital is critical. Unfortunately, most of the people are not getting to the hospital in time for us to intervene, right? So they'll have the symptom, and as you mentioned with your mom, your dad didn't really know the symptoms, and so it took a while for them to get to the hospital. And there are some treatments that we can initiate, and we can talk about that if there's time. But the most important thing is know that if you're at risk for a stroke, and we can talk a little bit about what those risks are. And then if you do have a symptom, 911 is the way to get to the hospital. Obviously, there's parts of the state that don't have 911, so getting to health aid, getting to your clinic is really critical, so that we can then evaluate you properly, get the scans done that are needed to determine what exactly is going on.
And so, Chelsea, what kind of symptoms did you have? Did you experience these, and how quickly did you recognize, or someone around you recognize, what was going on?
I was just sitting on the couch, and all of a sudden I noticed my whole left side of my body was, I would say, gone. I was lifting my arm up with my right hand, and it just kept falling down. And I was on FaceTime with my friend in Idaho, and she actually was like, "What's wrong with you? Why can't you speak?" And she was able to call my mom, who then called my 12-year-old, who actually noticed the signs right away. And he was able to call 911 to get them there super fast. So it was, be fast. He didn't have any prior knowledge of symptoms of stroke or anything, but he did notice there was something going on with my face and my speech, and my whole left side, was completely gone. So.
How did that feel? Just not having not experienced it, what does that feel like in your head? Did you, besides the physical part, did you notice that something was not quite right?
The only thing I noticed was that I couldn't get my speech out. Like I was talking in my head, I was talking, but it wasn't coming out like the way I wanted it to come out. And then, like I said, trying to lift my left arm up and it just kept falling down. I was like, in my head, I'm like, something's going on with my body. But because I was sitting, I didn't fall down, which was good, but I would have completely fallen over if I was standing at that time. And I had no signs, like it just all of a sudden started.
And so, if you don't mind me asking, of the two types of strokes the doctor just described, which did you have? Um,
I can't really remember exactly which one it was called, but I had 3 blood clots go into my right side of my brain. And so they came from my neck, and they were able to get to me. I was able to get seen and actually in surgery within a matter of like 30 minutes. I was able to be seen by the doctor. So that's why I think I am able to function the way I am now.
So, Doctor, speaking about that, let's talk a little bit about we have the two different kinds. Is there any difference in being able to prevent them? Are they caused by the same things? Because I know there are some things we can do to prevent strokes, or at least lessen the chance of one. Are they both caused the same way?
Yeah, so when we look at the ischemic stroke, which is a non-bleeding stroke, there are three main causes for that in large categories. So it's either a heart problem, it is a blood vessel problem, or it's a blood clotting problem. And each of those where a blood clot can form and obstruct a pathway of blood to the brain, those are all those ischemic stroke. Now, some of the risk factors for that, such as high blood pressure, diabetes, tobacco use, now we know marijuana use, we're looking at all those things can create both a hemorrhagic or bleeding stroke as well as an ischemic stroke. There's some additional risk factors that can cause a non-bleeding stroke that's different from the hemorrhagic strokes or the bleeding strokes. In addition to the bleeding strokes, patients can also have aneurysms that are in that category, and they develop what's called a subarachnoid hemorrhage, where that vessel can rupture and create damage. And that can mainly be associated with tobacco use. Genetics are playing a role in that. And then there's some large group patients that they occur. We don't really understand why, that they get the aneurysms. But the bleeding strokes, there's a big overlap in those risk factors. Now, I always tell patients that the best way to survive a stroke is to never have a stroke, which means that primary prevention is really important. If we look at the number one, the top 5 reasons why people die, stroke is the most preventable. And what it means that the brain in a lot of ways is very forgiving. So it has a massive amount of blood supply, and those blood vessels do have the ability to be modified. So if you quit smoking, for example, after 2 years, those blood vessels behave as if you haven't smoked. In the same way that if you control your blood pressure, then those blood vessels have the ability to modify. And even if one blood vessel closes down, we have an amazing amount of what's called collateral circulation that other blood vessels can take over that function. One way to kind of look at your risk, so the American Heart Association has life's essential 8. So if you just put that in your computer, it'll pull out and really looking at those 8 main categories to maintain your health. So it looks at, which blood pressure, blood sugars, your cholesterol, your weight, exercise level, tobacco use, sleep is an important part of it. What you eat is important. So all those 8 components, and then you can take a look, and they have a little test that you can do. They also have these life essential 8s for kids, which is important as well. And so both of those, sort of paying attention to those things can really modify both your risk for heart attack as well as your risk for stroke.
And so, Chelsea, how has your life changed since you had your stroke?
I basically went back to normal. Just like I said, I didn't have a lot of side effects from it. I was only in the ICU for 4 days and then was able to go home. I have really changed my eating habits. I've actually lost 105 pounds since last year. Just trying to stay healthy and be there for my kids, because it was close call there, and I just wanted to make sure to be healthy and drink lots of water and really watch my blood pressure. That was the other thing, is before my stroke, I wasn't really into taking my medications, and now I'm like clockwork, like take my medications, make sure to be on time with everything, not miss anything, and just keep up with being healthy.
And so, since I have both of you, when people come to you and say, I'm not at risk for a stroke, of course, what would you tell them? What is your best piece of advice if you have one single piece of advice that you could give to somebody about preventing strokes? Doctor, what would you say?
So one is to get engaged with healthcare. And I think the biggest risk is like, for example, for men, a lot of times once you hit 18, you won't see the doctor again until you're 55. And during that whole time, you may have high blood pressure, sleep apnea, cholesterol issues that will all come into play. So becoming engaged with healthcare to make sure you know what your numbers are, get a blood pressure cuff, get your blood pressure checked. You recognize that there's no good smoking. Regardless of what you're smoking, you're putting stuff in the lungs, it's damaging you. And getting rid of those things. Looking at what you're doing for exercise is really important. So as far as one thing is just to, we do a lot of, I was thinking like in Alaska, we do a lot of preparation if we go for a hunt or if we go for a long hike or we go on a camping trip. But we do all this preparation and think of what are things that I need to make sure that I get back safely. But yet we don't do that with our health. And we do that with a hunting trip, but we don't do that with, is my blood pressure there? So we need to take as good of care of ourselves as we do in preparation for doing things in the outdoors here in Alaska. So that's that's probably the most important thing that I think of is to know where they are. Most of the time patients come in and they don't have a knowledge that they had high blood pressure for several years or that their kidney function is poor. They never got blood work. They don't go to the doctor. So I think those are really critical issues that we can make prevention because I'd rather prevent the first stroke from happening than try to prevent the second one from happening.
Oh, sorry. I told you I might forget to turn on my mic. Chelsea, what about you as somebody that has lived through the experience? What do you tell people, kind of give them some advice?
Well, basically, I just tell people that, before I had my stroke, when I heard the word stroke, I thought old people, that's all it happens to. But I was 36 when it happened, and I was super shocked that it happened. And just making sure to keep track of, your blood pressure is one of the biggest things, I think, also, because that was, I think, one of the factors that made me have my stroke. And just the fact that it can happen to anybody at any time, honestly, and just to know the signs and just keep track of, your health and stay healthy.
And doctor, you kind of mentioned at the very beginning, if we're there and we see somebody, let's go over those signs again really fast. If we do see somebody that, because recently I've had a friend that has gone through this, his wife recognized it very quickly and he was able to get to the hospital. So what should we be looking for if we see somebody? What should trigger in our brain? What should we do?
Right. So as Chelsea mentioned and brought it up, is stroke is abrupt. It is a instant change because if you lose blood supply to a group of nerve cells, those nerve cells maybe have a couple seconds of energy supply and then they shut down. They just turn off like a light and there's an instant loss of function. And so as soon as, if stroke happens, since it happens suddenly, you just go through those quick tests. You say, can you stand up? The moment one of those of the BFAST is not working, that's a 911 call. So if the person can't stand up, 911. If they can stand up, but then you lose vision on one side or the other side of the person seeing double, that's a 911 call. Immediately, if you see their face is drooped or their arm is weak or they're not able to talk to you, that's all 911 call. And that's all we want folks to do is just to be able to pick up the phone. We always say, don't regret, just act. And make sure that we're not waiting for something to go away. And so then the faster you get there. I do want to kind of do a little bit of a shout out in that regard. So one of the biggest challenges in Alaska is getting people to the hospital once they do get identified. So we do a pretty good job here in Anchorage and the Anchorage Bowl and out in the valley, whereas, 15 years ago, it took an average of 17 hours for a patient after their stroke to get to the hospital, which means we can do no intervention. Now we're looking at how do we get folks from the villages, how do we get from the areas that need to fly in for urgent care, and through the Alaska Stroke Coalition, which was just founded last year, a nonprofit organization. If you do want, there's great information about that through alaskastrokecoalition.com to take a look at that. And then we're training our EMS folks, and just to shout out to them, it's EMS Recognition Week. And so without EMS, without our first responders, we could do none of what we do in the hospital. It's really critical for them to be trained at a high level to be able to evaluate the patients. That's why it's so critical. Call 911. So when they get to the scene, the changes that are occurring, in the brain is a dynamic system. So what happens when they arrive, that's a critical piece of information that if you drive in, it's lost. In addition, I've had patients who decide to drive their loved one in and the person gets worse and that person gets in an accident because they're trying to take care of the passenger. So 911 is critical. We get more information. The EMS folks call ahead. We get our teams together. So like with Chelsea, to be able to put a catheter in and pull clots out is really critical. But we only have a small window of opportunity to give clot buster medications, which is going to be ideally within an hour after you have your event. But up to 4.5 hours. And then we can put catheter-based treatments that can go up to 24 hours. But again, that doesn't mean that we can wait for 24 hours. It's just that by the time that bell rings at 24 hours, there's not much left to do and you're stuck with that disability. That's the biggest problem with stroke is patients become disabled.
Yes, like I said, that was what happened to my mother. She survived, but she was, her speech was impaired and her left side of her body was weak for the rest of her life. So definitely good information for us, and as you mentioned, for all Alaskans, particularly if you are in a rural area and you need to get help extra fast. So thank you both so much, Dr. Robert Latta and Chelsea Hunt. I really appreciate you guys spending a little bit of time with us to just kind of go over some of these topics and maybe we help somebody who didn't know some of those signs. So thank you guys for joining us so much here at Alaska's News Source.
Thanks for having us.
Thanks. Have a great day.